Well, hi. So often if you're looking to figure out what the heck is going on with you and you feel like you have an inflammatory condition, which, let's be honest, if you have any kind of chronic symptoms that you're experiencing, there is a root of inflammation at the core of it. Even type 2 diabetes has an inflammatory component and considered an inflammatory disease. And it can feel really frustrating if you don't fit in that box. So if you've done the gamut, you've done the CBC, the CMP, you've got the CRP, the inflammatory markers, or the ESR, you've looked at your ANA and you've tried to figure out the autoimmune markers or your RA factor, and you're coming up empty-handed, or nothing is pointing specifically to something where you go, diagnoses. So I see problem, so I see solution, and you feel like you have interventions that you can achieve, or in some cases, the interventions are not something you're interested in trying. You'd like to get more at the root of the problem. Then there are more things to look at. You're not at the end of your rope. If you don't fit in the box of that medical diagnosis, that doesn't mean there isn't a fix for it. So often in our practice, we'll look for testing like organic acids, where we're looking at byproducts of things that are like, hey, what is happening upstream that might give us clues as to what's going on from that chronic inflammatory thing that you're experiencing. Or we'll look at mycotoxins or bacterial imbalances, whatever. There's so many things that we can look at from a functional laboratory standpoint that often aren't typical or standard when you're going to the normal doctor's office. Another tool you have is just testing your HRV, looking at your stress response to things and seeing if there's things in your lifestyle, behavior, activities that are modifiable. A great example is I've been testing keeping my watch on while I sleep and watching for stress response or inflammation, I should say. But what's the stress, right? That's your little marker that will say stress on your smartwatch or your Oura Ring or your Whoop or whatever it is. And having a few alcoholic beverages before bed means between 12 and 3 a.m., I have stress markers. Even though I'm sleeping, my body is not recovering because the liver is having its turn to process. Or there'll be certain meals that I have during the day that my stress is like a little solid wall, even though it's whole foods, but it's things I know I'm sensitive to. So there are other doors to knock on. If you have questions and you're tired of DIYing it, maybe reach out. We're here to help.